Symptoms of diabetes mellitus. Diabetes mellitus is a fairly common illness found in dogs and cats. Just like in humans, this disease is devastating to the body when left undiagnosed and untreated. Symptoms are often subtle in the early stages of diabetes, advancing to widespread deterioration in the health of the patient as the disease progresses unchecked. In diabetic animals, the blood sugar level, or blood glucose, is elevated above the normal range. Elevated blood glucose is called hyperglycemia. Glucose is the energy source for all cells in the body. The heart, brain, and all other organs and tissues in the body require glucose to function and survive. When food is consumed, the body takes the food and breaks down fat, protein, and carbohydrates for energy. During digestion, food is broken down into a basic unit of fuel known as glucose. The glucose is then absorbed into the bloodstream, where it is carried to all cells throughout the body to be used as energy. However, cells cannot utilize the glucose without a mediator known as insulin. Insulin is a circulating hormone produced in the pancreas. After a meal, the body's blood glucose levels rise, and the pancreas responds by releasing more insulin into the blood. The amount of insulin produced is directly related to the amount of glucose in the blood. The hormone then transports the glucose into the cells where it is spent as fuel. Cells cannot utilize glucose without insulin, and the insulin must be recognized by the cells in order to deliver glucose. Diabetes is an interruption in this critical process. Diabetics may have either or both a deficiency in the production of insulin, type 1 diabetes, or a resistance to the mechanism of insulin, type 2 diabetes. In either case, glucose is not delivered effectively to the cells, and instead remains in high concentrations in the bloodstream. The symptoms of diabetes, however subtle or apparent, are caused by both the reduction in the delivery of glucose to the cells and the elevated blood levels of glucose that is unused. Diabetes tends to afflict adult dogs and cats, and since they cannot communicate how they're feeling, lethargy is often mistaken for maturity. It would be obvious that something was wrong if a rambunctious puppy or kitten suddenly became lethargic. But a mellow adult dog or cat may seem normal when it's actually energy deprived. Therefore, lethargy is often overlooked as a first symptom of diabetes. More noticeably, the cells being starved for glucose causes the animal to feel a constant sensation of hunger. The term used for increased hunger is polyphagia. Despite an increase in food intake, diabetics will begin to lose weight. This is because they are not able to utilize the glucose that is derived from food. Instead, the body begins to burn fat stores in order to survive. Because obesity is a contributing factor in the onset of diabetes, many diabetics will present as overweight patients that exhibit unexplained and sudden weight loss. The elevated levels of unused glucose in the bloodstream, on the other hand, cause more significant symptoms. Increased thirst and subsequently increased urination are profound symptoms of diabetes. Increased thirst and urination are referred to as polydipsia and polyuria, respectively. Furthermore, when blood sugar levels reach a threshold, glucose will begin to spill over into the urine, becoming food for bacteria. Ascending urinary tract infections are very common in diabetic animals, causing urinary accidents to be a very common symptom. Many diabetic patients are first diagnosed when presented at the veterinary hospital with the complaint of inappropriate urination. In diabetic dogs, cataract formation occurs in almost all cases, even after treatment is pursued. This does not occur in cats. Cataracts are an increased opacity in the lens of the eye, impairing vision. Cataract formation in a relatively young dog makes them a suspect for diabetes mellitus. To summarize, symptoms of diabetes may be vague and subtle at first, progressing to an obviously unhealthy appearance of the pet. Lethargy, increased water consumption and urination, weight loss despite an increased appetite, and early cataract formation in dogs are all symptoms that describe a diabetic pet. Some of the terms that veterinarians use to describe a diabetic pet are hyperglycemia, increased blood levels of glucose; lethargy, decrease in activity due to fatigue; polyphagia, increase in appetite; polydipsia, increase in thirst; polyuria, increased urination; cataracts, increased opacity in the lens of the eye. In the next section, we will discuss the factors that may play a role in causing diabetes mellitus.